And welcome back to News Channel 3 on a Thursday. A new heart procedure at Borges is providing better outcomes for older patients.
And Marcy Kobriger has more on a new fix for a common age-related condition in tonight's Doc Talk.
91-year-old Dorothy Bordeaux is still incredibly active.
I do all my housework. I'm one of them weird things that iron. I think that's quite a feat when I look around at the young ones.
And fiercely independent, at times to her family's chagrin.
She doesn't like to ask anybody to do anything for her. You just kind of go out and say, well, this is what we're going to do today.
But earlier this year, Dorothy was forced to slow down and ask for help.
I just started dragging around, and usually I'm on high gear. So then the pain set in my chest.
Her daughter, Barb, drove her to Borges, where doctors discovered she was suffering from senile aortic valve stenosis.
You know, the valve's been opening 60 to 100 times a minute from before she was born and for every day of her life, and after a while it just begins to wear out.
The main valve that allows blood out of her heart was failing and had to be replaced. And even though Dorothy was a spry 91, she was 91.
An open heart surgical valve replacement, although it's a great operation, is a very large operation with significant risks and long recuperation. And as people become older, it often becomes difficult to decide, if they're candidates still for that type of large operation.
Dr. Seltiel determined Dorothy was a good candidate for a new alternative procedure. Doctors performed a transcatheter aortic valve replacement entering through the groin. A guide wire is used to move a collapsed replacement valve through an artery and then place and expand that valve in the patient's heart using a small balloon. Recovery is usually quick, but Dorothy's recovery surprised everyone.
They said I was the talk of the hospital.
She was supposed to be in recovery for 2.5 days, and I think she was out in the same day in her own room.
And even for this procedure, she's in the older side of things. And it was just, very gratifying to see how quickly she came along after procedure. She was up and about very quickly.
Now, months later, Dorothy is out and about and back to her life as normal.
Well, I just went back to what I used to be, in gear.
For Doc Talk, Marcy Kobriger, News Channel 3.
Feels better to be in gear, doesn't it? For more information, head to the link section of our website, WWMT.TV.